Clubbing. The term clubbing refers to a physical sign involving the bulbous enlargement of the distal ends of the fingers and toes. The normal angle between nail and nail bed is 160 degrees and is called the Lovibond angle. How to check for clubbing? View the patient's fingers from a dorsal and lateral view. Note the width of the distal phalanx. It is usually increased in advanced clubbing. Bring the patient's finger at your eye level and look tangentially at the onychodermal angle. If it is more than 180 degrees, clubbing is said to be present. Test for fluctuation. The patient's finger is palpated over the base of the nail by the tips of the examiner's index fingers. Clubbing is said to be present when fluctuation is obvious. Here, the palpation of the nail bed may give the impression that the nail is floating on its bed, hence the name, floating nail sign. Shamroth's sign. When the dorsum of the distal phalanges of the fingers of both hands are approximated to each other, a diamond-shaped gap is seen, which is known as Shamroth's window, and its obliteration is referred to as Shamroth's sign. There are 4 grades of clubbing. Grade 1 clubbing is characterized by softening of the nail bed and positive fluctuation test. In Grade 2 clubbing, there is obliteration of the angle between nail and nail bed. Grade 3 is characterized by an increased curvature of the nails. This is called the parrot beak or drumstick appearance. In Grade 4 clubbing, hypertrophic osteoarthropathy is noted. The causes of clubbing are pulmonary and thoracic causes, which include suppurative lung disease such as bronchiectasis, cystic fibrosis, lung abscess, pulmonary and thoracic malignancies, long-standing TB, neurogenic diaphragmatic tumor, pulmonary AV malformation, sarcoidosis, cardiovascular causes including cyanotic congenital heart disease, bacterial endocarditis, atrial myxoma, and Eisenmenger syndrome. Gastrointestinal causes that include cirrhosis of liver, inflammatory bowel disease, and gastrointestinal malignancies. Congenital or familial conditions, such as congenital hypertrophic pulmonary osteoarthropathy. Miscellaneous causes such as syphilis, syringomyelia, acromegaly, and thyrotoxicosis. Acquired clubbing may be unidigital or pandigital, unilateral or bilateral, and differential clubbing. Unidigital clubbing may be due to trauma, gout, and sarcoidosis. Unilateral clubbing may be seen in Pancoast tumor, aneurysm of aorta, subclavian, or innominate arteries, branching AV fistula, and hemiplegia. Clubbing that is limited to upper or lower limbs alone is termed as differential clubbing. It may be seen in patent ductus arteriosus, with reversal of shunt, where cyanosis and clubbing occur, in the lower extremities only. Pseudo-clubbing. In pseudo-clubbing, there is an increased curvature of the nails, but the Lovibond angle remains the same. It is associated with leprosy, vinyl chloride worker, and leukemia. Clubbing and cyanosis may occur together in congenital heart diseases and pulmonary diseases. Clubbing and lymph node enlargement together may occur in gastrointestinal, pulmonary, and other malignancies, tuberculosis and sarcoidosis. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.